Hi there, my name is JC, and I am a pharmacist. Today, let us talk about common oral over-the-counter drugs, or OTC drugs for cold. And for those of you who have no idea what an OTC means, well, these are medications that can be bought in a pharmacy without a need of a prescription from a doctor. First of all, a cold or a common cold is a condition with a symptom that includes nasal congestion. And oftentimes, people go to a pharmacy seeking for a remedy for this illness. These remedies are collectively known as nasal decongestants. Two of the most common oral nasal decongestants that I will be talking about are phenylpropanolamine and phenylephrine. Here in the Philippines, especially during rainy days, many of us have a high likelihood to be affected with common cold. That is because this disease can easily be transmitted from one person to another just by exposing ourselves to those who already have this illness. And usually, common cold is associated with fever and headache. That is why some of the available medicines contains a combination of two or more drugs, one of which is a nasal decongestant, an antipyretic or analgesic drug, and an antihistamine or anti-allergy. So let us discuss first the drug phenylpropanolamine. This drug comes in the form of a capsule, a tablet, and a liquid preparation. PPA has a dosage strength ranging from 18 milligrams up to 180 milligrams, depending of course on which brand you are taking. Now, just a quick trivia. Do you know that phenylpropanolamine is also used in some diet pills due to its weight loss effect? Yes, that is true. Phenylpropanolamine reduces weight by suppressing an individual's appetite for food. In veterinary medicine, phenylpropanolamine is also used in animals to control urinary incontinence. Now let's go back to its use as a nasal decongestant. Phenylpropanolamine's adult dose is a 25 milligram tablet with the shortest interval of every 4 hours with a maximum of 6 tablets per day, meaning an adult dose should not exceed 150 milligrams per day. In pediatrics, especially those who could not tolerate capsules or tablets, a liquid preparation of 12.5 milligrams per 5 ml is much preferable. However, dosage may vary depending on the child's age and weight. That is why it is best to consult with a pharmacist or a doctor for an accurate calculation of a child's dose. Phenylpropanolamine can be taken with or without meal, and should be taken with a full glass of water. Now, this drug works as an alpha adrenergic receptor agonist with a lesser affinity to beta adrenergic receptor in the mucosa of the respiratory tract, which when stimulated, it produces vasoconstriction, resulting in a decreased nasal congestion and an increase in airway patency. Phenylpropanolamine may indirectly stimulate beta receptors, producing tachycardia and a positive inotropic effect. Now, the second most common drug for cold is phenylephrine. Phenylephrine comes in a 5 mg and 10 mg tablet, in a 1 mg per ml and 2.5 mg per 5 ml liquid preparation in combination with other drugs. Phenylephrine also comes in an injectable solution used in treating hypotension and shock. Phenylephrine's adult dose is a 10 mg tablet with the shortest interval of every 4 hours with a maximum of 6 tablets a day, or should not exceed 60 milligrams within 24 hours. Phenylephrine's dosage may also vary depending on the child's age and weight, and a visit to your pharmacist or a doctor will be helpful in determining a child's dose. Phenylephrine may be taken with or without meal, and should be taken with a full glass of water. This drug is a sympathomimetic agent which stimulates alpha adrenergic receptor, which causes vasoconstriction, resulting in a reduced nasal congestion. As mentioned earlier in this video, both phenylpropanolamine and phenylephrine may also come in combination with other drugs, not only to treat nasal congestion, but as well as fever, headache, and itchy nose. Most commonly combined drug is the antipyretic analgesic paracetamol, also known as acetaminophen in some countries. Phenylpropanolamine plus paracetamol comes in a 25 mg per 325 mg tablet or capsule and a 12.5 mg per 250 mg in a 5 ml liquid preparation, while phenylephrine comes in a 10 mg per 500 mg tablet. Antihistamines or anti-allergy drugs are also combined with phenylephrine or phenylpropanolamine. These are chlorpheniramine, also known as chlorphenamine, and brompheniramine. A common side effect when taking anti-allergy medication is drowsiness. So be sure not to drive a car or operate on heavy equipment, as these are prone to accidents. A combination of 3 drugs in one tablet form is also available in the market. It is either phenylpropanolamine plus paracetamol plus chlorphenamine or phenylephrine plus paracetamol plus chlorphenamine. All of the said combinations can be taken with or without meal and should be taken with a full glass of water. Well, water helps in many ways, one of which is it lessens the viscosity or the thickness of the mucosal secretion, which is why it is best to take cold medications with a full glass of water. Now, when taking cold medications, as well as with most other drugs, it is highly recommended to avoid in consuming any alcoholic beverages, as alcohol may interfere with the effectivity of a drug or may increase the individual's risk for the drug's toxic effect. When taking phenylpropanolamine or phenylephrine, we need to also monitor our blood pressure, because these drugs has a tendency to increase our blood pressure. That is why cold medicines with either phenylpropanolamine or phenylephrine is not recommended with hypertensive patients. These cold medications are to be taken in a span of 5 to 7 days, and if symptoms still persist, it is advised to consult a doctor to properly manage your condition. And that's all for today, and I hope you learned something. And if you do, please hit the like button, subscribe to my channel, and click on the bell button for updates on my coming videos. That's it. See you in my next video, and always remember, it is safer when you know your medication. Once again, this is JC, your pharmacist.